Hello and welcome to the Department of Medical Imaging at the University of Arizona and Banner University Medicine in beautiful Tucson, Arizona. I'm Dr. Jeff Rubin, chair of the department. We are delighted that you have chosen to become a radiologist and are interested in learning more about our excellent training programs and distinguished department. Here within our stunningly beautiful environment, we are passionate about the diverse community that we serve. Diagnostic imaging and image-guided therapies are critical contributors to the health of our community, both for today and into the future, which is why resident education is a top priority in our department. You represent the future of our field, and our commitment is that we ensure the highest levels of education and training so that you are prepared to bring the highest value to your patients as future radiologists. Thank you for exploring residency training with us. I hope that the day is both informative and enjoyable.
Hi, I'm Greg Woodhead. I'm the program director for the Interventional Radiology residency at the University of Arizona. I'm actually a product of this training program. I did my DR residency at the U of A, followed by IR fellowship. I have a commitment to this program, and I need to make sure that your experience as a resident is outstanding and that the program remains strong. Three strengths of the IR program at the U of A Tucson are the depth and breadth of our training, our core philosophy of improving your skills through a process of increasing autonomy, and the outstanding resident work-life balance.
I chose radiology because I love imaging and I love people, and I love that radiologists have an intimate relationship with every single patient that's inside the hospital.
The procedures are really amazing. You get to help patients with cancer. There's tons of research opportunities in it. So I felt like, as a specialty, it was uniquely suited for me.
I wanted to do something procedural, but also there continues to be a lot of exciting things going on in interventional radiology from both a clinical and a research perspective.
And what really differentiated this program from others is the degree of autonomy that you get here.
The attendings are very good about letting you try things once you've proven that you're capable.
Being able to be the primary operator in some of these major cases, having the opportunity to troubleshoot problems is what makes this program great.
If I have a question about research or a procedure or call, be it whatever, they're very approachable, and I really love that about the program.
Be at a place that is that supportive is really helpful. It makes kind of all of the clinical stuff and the constant studying that you have to go through in residency become a little bit more, a lot easier.
About a year of diagnostic radiology and then getting a few, interventional radiology rotations. Well, that kind of helped me decide that I wanted to make my difference, by doing procedures, and doing some more hands-on things, getting a little more patient contact and patient interaction.
I will be the first female and first DO integrated IR resident to be joining the program here.
I also really love the camaraderie in the program. I'm very close to my co-fellows, my co-residents, and I feel like we're more of a family. There's no competition here for anything.
I chose the University of Arizona because I wanted a large level 1 trauma center, have the access to a transplant center because the imaging is very unique. I also like that it's a cancer center, so you can see disease processes at many different states.
The IR service at the U of A Tucson performs between 30 to 40 procedures each day. We have a comprehensive IR practice and a modern workspace. The residents work primarily at the main U of A Banner Tucson hospital. This hospital includes 3 main angiography suites, 2 angio-light rooms, a dedicated CT procedure suite, a paracentesis clinic, in addition to a 40-bed pre-op, post-op recovery room.
The University of Arizona was important to me because of the number of women attendings and program directors and leadership, so that I could have specific female mentorship in a field that does not have a lot of women in it.
Here at U of A, we have the ESIR track, the Early Specialization in Interventional Radiology track. I'm very pleased and very happy about it.
We get access to a number of resources, and those things include Rad Primer, StatDX, and having such a resident-driven program, one of the aspects of that is having receptive faculty, and I think we do have that.
We're relatively isolated geographically with a catchment area of over 1 million people, so we get a lot of good trauma experience.
In addition to our busy IO program, we perform all aspects of modern IR, a good number of prostate artery embolizations, uterine artery embolizations, and thoracic duct embolizations, among others. Also, we perform many complex portal interventions, including TIPS procedures, PVR tips, Berto, Carto, etc. Important new additions to the IR faculty at the University of Arizona Tucson include a faculty member who specializes in peripheral arterial disease, hoping to bring increasing endovascular treatment of PAD to our practice. Also, we recently hired a neuroradiology trained neurointerventionalist. So as a resident here, you'll have the opportunity to scrub cases in neuro-IR as well as learn all of the unique features of that clinical practice.
Tucson in general and the program are definitely family friendly.
Very easy city to live in, easy city to get around in. It's affordable.
I think I have an excellent work-life balance here as a surgery resident.
9 or 10 months of the year, the weather is just perfect, and so I golf a lot.
If you can survive the summer heat, the winters and the fall, and the spring are amazing.
We're happy with the schools that we send our daughter to. We're able to own the house that we live in. The schedule is totally reasonable for being a parent and having children.
Did a couples match with my wife. The program has been very helpful in sort of coordinating the difficulties that come with having a significant other who is in medicine. We were expecting a baby, and their response to me was, let us know when the baby comes, and you have as much time as you need.
If I'm not on call, I have ample amount of time to pursue my whatever extracurricular activities I may be planning to pursue.
We are a very busy service, a large hospital, and so there's a constant need for our services, which we're happy to provide.
But our call is very busy. It's where you get some of the best learning. I'm very excited because those are the best cases and the best learning opportunities because you are one-on-one with an attending.
Fellows and senior residents do a great job of making sure that we get to scrub into even some of the more difficult cases early on.
Kind of almost a requirement that as an IR resident you will be doing research, and that starts from day one. We're all involved in multiple projects. We've all gotten abstracts accepted at the big national meetings such as SIR and Guest.
We have a lot of backing from Banner, from the University of Arizona in terms of research facilities, funding, as well as time within our own residency program to be able to get some of those projects done.
There are tons of research opportunities and you will not be starved for them.
The IR program at the U of A Tucson includes 1 integrated resident each year, 2 independent residents each year, and a mix of ESIR residents drawn from our outstanding DR program.
But you need to be very hardworking, very adaptable, very flexible. You've got to really love IR. You've got to love wanting to do these procedures. You have got to love wanting to help patients because it's a very demanding career. That being said, it's very rewarding, and so, me personally, I love doing procedures and I love seeing patients get immediately better.
We're looking for IR residents who have an interest in clinical excellence, have a great attitude and are solid team players, and who have a drive to perform cutting-edge clinical practice and research.